Healthcare is very much on all of our minds because it affects every single person in our country. Healthcare is a right, not a privilege, reserved for those who can afford healthcare coverage. So, particularly for people living with serious diseases, Trump Care sends a message, basically, you're on your own. And this discussion draft, it's not even a bill, and I was asking my colleague here, Senator Murray, what's a discussion draft? It's a new animal. That's what we're dealing with in terms of the Senate version of health care. But this draft undermines protections for Americans living with pre-existing conditions, and we will hear 3 stories from people who understand what this means to them and to their families. And there are millions of people living in this country with pre-existing conditions, and you can bet that they have been following the bill as it emerged from the House, which was really devastating, and then to see what's in store in the Senate bill. So today also happens to be World Kidney Cancer Day, and that's why many of us are wearing these orange items and ribbons. And I just want to mention that, my own experience tells me that we are only one diagnosis away from a major illness. I was always healthy. I'd never been hospitalized except when I was 17, and that was a false alarm. And I have recently been diagnosed with a stage 4 kidney cancer, and I am dealing with that. I feel well, but not out of the woods. So I can certainly relate to the millions of people in our country who are very concerned about what this bill has in store for so many of us.
There are over 15 million cancer survivors alive today in the United States, each of us with a pre-existing condition. Each of us is vulnerable to high insurance costs, and that's what's going to happen if Congress passes a law allowing insurers to rate people like me based on their health status. Unaffordable health care is terrifying. It's terrifying to think about there's always the possibility that I and so many other childhood cancer survivors may hear those 3 words, you have cancer, again.
Just this week, I filed paperwork with the state of Virginia to start my own business, a home health care business to provide care to the elderly and the disabled. None of this would have been possible without the ACA guaranteeing me health care coverage. If the Senate votes to take away that protection and allows me to be charged more for health insurance, or allows states to waive comprehensive coverage, my dreams will be dead before they even have a chance to live. And while I don't need Medicaid yet, I live with an expensive chronic health condition, and one day I might not have anywhere else to go. I'm very concerned about capping Medicaid, which will certainly lead to reduced eligibility for those like me and others with other conditions.
There are many important, very important protections in place today that are just at risk, like the pre-existing condition protections, prohibition of annual and lifetime caps. If those things go away, or come back to us, I should say, life changes again. Without insurance, we would be looking at upwards of $350,000 annually for Allison's treatment and care. We work hard and have good jobs, but that's outside our reach. That's not going. I can't imagine looking at my 16-year-old who thinks the future is laying in front of her and saying, not sure you're going to have what you need. That drug you have right now that's changing everything for you, we might have to not take that anymore. That's not okay, and I won't do that. And we can't do that to kids like Allie. My daughter and others with chronic complex diseases need access to affordable health care that meets all of their needs, not just this one or that one, all of their needs. And I hope lawmakers, including Senator Portman from my home state of Ohio, keep Allie in mind while they're making these critical decisions over the coming days. Thank you so much for letting us talk to you today.
There's a word in Hawaii that we apply to this kind of flim-flammery. It's called shibai, meaning that you put something out and you call it something when it's really the opposite. This is not a health care bill that's going to help the people in our country. And let's not forget that there is a huge tax cut for the richest people in our country with both the House and the Senate versions of these bills, and this tax cut is on the backs of the poorest, sickest, oldest people in our country. It is unconscionable. So now we'd like to open up for any questions that you all may have. Yes.